Hey everyone, and welcome to this explainer. So, did you know that your stomach acid is literally potent enough to dissolve a razor blade? It's true. It's an absolute chemical powerhouse down there. But the crazy part is how it manages to hold all that destructive power without, digesting itself. Well, most of the time anyway. If you're the kind of person who loves getting into the nitty-gritty of exactly how the human body works and why it occasionally goes off the rails, you are totally in the right place. Today, we're diving deep into gastritis. We're going to break down the clinical pathophysiology and look at exactly how we manage this condition. It's a seriously fascinating look at the microscopic battles happening right now inside our digestive system.
Okay, let's dive right into this. Think of your stomach as this incredibly heavily fortified castle. It's perfectly designed to contain highly corrosive acid to break down your food. But what actually happens when the castle walls themselves come under attack? Well, modern lifestyle factors, things we deal with every day like chronic stress, alcohol, maybe irregular eating habits, and honestly, the widespread use of everyday painkillers like NSAIDs, they are actively fueling this silent, persistent attack on our stomachs. To really wrap our heads around this, we need a roadmap. Here's what we're covering in today's explainer. Number 1, what is gastritis? 2, causes and culprits. 3, the battle inside. 4, symptoms and diagnosis. 5, the treatment plan. And finally, number 6, prevention and complications. Let's get going.
What is gastritis? Establishing the clinical baseline.
So, by clinical definition, gastritis is simply the inflammation of the gastric mucosa. That's the protective lining of your stomach. This inflammation kicks off due to irritation, infection, autoimmune issues, or just prolonged exposure to harmful stuff. And it's definitely not a one-size-fits-all kind of deal. It ranges anywhere from mild irritation that you might brush off as a minor stomachache, all the way up to severe erosion and bleeding that completely wrecks your gastric function. Basically, at its core, it's a critical failure of the stomach's natural defense system.
Now, what's really interesting here is the stark contrast in how this condition actually presents. We generally group gastritis into two main buckets. First up, acute gastritis. This one hits suddenly, doesn't last long, and the good news is it's usually totally reversible. It's the kind of thing that gets triggered after, say, a really heavy weekend of drinking, intense physical stress from an injury, or maybe just popping way too many NSAIDs. But contrast that with chronic gastritis. This is a slow, gradual onset, long-standing inflammation. And if you leave it unchecked, it can actually cause mucosal atrophy, which literally means your stomach lining physically wastes away. And the main culprit driving this chronic form? A very sneaky bacteria known as Helicobacter pylori.
Section 2. Causes and culprits, breaching the fortress walls.
So, what's actually breaching these walls? The list of attackers is surprisingly common, and honestly, they are relentless. Right at the top, like we mentioned, is the H. pylori infection. It aggressively sets up camp in the stomach lining and starts pumping out damaging toxins. Then we have NSAIDs, your standard over-the-counter aspirin and ibuprofen. These guys are notorious because they block the synthesis of prostaglandins, which are absolutely crucial for building up your stomach's protective mucus. Then you've got excessive alcohol, which directly erodes that mucosa, and smoking, which actually chokes off gastric blood flow so your stomach can't heal itself. We also see severe stress causing gastritis, especially in critically ill patients dealing with massive trauma or burns. Throw in autoimmune attacks where the body turns on its own gastric cells, plus diet factors like super spicy foods or bile backflowing into the stomach, and yeah, you can really start to see just how many threats your stomach is constantly fending off.
Moving on to Section 3, the battle inside, the pathophysiology of gastritis.
Fundamentally, gastritis is what happens when a very delicate physiological balance completely breaks down. On a normal, healthy day, you've got the defenders keeping your stomach safe. This includes a thick mucus barrier, bicarbonate secretion to instantly neutralize acid, a rich blood supply delivering nutrients, and those prostaglandins we talked about keeping the whole defense network running smoothly. But they're constantly at war with the attackers. These aggressive factors include hydrochloric acid and pepsin. Now, normally they're the good guys breaking down your lunch, but they will absolutely chew through your stomach lining if given the chance. Add in external invaders like H. pylori toxins, and well, when the attackers finally overwhelm the defenders, that's when gastritis strikes.
Let's actually look at the mechanics and see how this damage builds, step by step. Step 1 is the initial breakdown of that mucosal barrier, usually thanks to the drugs, stress, or alcohol we just mentioned. Once that shield drops, we're right into Step 2, the increased acid effect. That potent hydrochloric acid starts going to work on the newly exposed super vulnerable tissue. This instantly sets off step 3, your body's inflammatory response, which brings on localized redness, swelling, and a whole lot of pain. And finally, step 4. If H. pylori happens to be hanging around, it actually burrows right into the mucus layer. It pumps out an enzyme called urease to neutralize the acid around it so it can survive, and then it releases toxins that cause deep cellular erosion and potentially severe internal bleeding.
Section 4. Symptoms and diagnosis, the warning signs.
All that microscopic physical damage we just mapped out, yeah, it translates directly into real-world warning signs that the patient absolutely feels. Usually folks will report this burning or gnawing epigastric pain right smack in the middle of their upper abdomen. Because the stomach is incredibly inflamed, it just kind of rejects food. This leads to nausea, vomiting, a total loss of appetite, and constant belching and bloating. But if things progress to that deep cellular erosion we talked about, we start seeing some really terrifying symptoms. Hematemesis, which is literally vomiting blood, and melena, which is the passing of black, tarry stools. Both are massive red flags that bleeding is happening high up in the digestive tract.
To confirm what's going on, doctors don't just guess, they take a look. Diagnostic evaluation relies heavily on an endoscopy, which is a direct visual inspection of the stomach lining using a tiny camera. While they're in there, they'll usually grab a biopsy to see if H. pylori is the culprit. They're also going to run blood tests to see if the patient has developed anemia from internal bleeding, along with stool tests to check for hidden or occult blood.
Okay, so the fortress walls are breached, the attackers are swarming, and the patient is in a lot of pain. The big question now is, how do we heal the damage? How exactly do we shift gears from crisis mode into recovery?
That brings us to Section 5, the treatment plan, medical and nursing management.
When it comes to medical management, the approach is super targeted. Goal number 1, disarm the attackers. We do this by throwing antacids at the problem to instantly neutralize the existing stomach acid, and we use proton pump inhibitors, or PPIs, to basically tell the stomach to stop producing so much acid in the first place. By dramatically dropping those acid levels, the stomach finally gets the breathing room it needs to rebuild that mucosal barrier. And of course, if H. pylori is in the mix, we deploy a strict, heavy-hitting regimen of antibiotics to wipe out that bacterial infection entirely.
But you know, clinical care is way more than just handing someone a prescription. It's about holistic, whole-person management. Let's make this concrete. Meet Mr. X. He was just admitted with a really severe flare-up of acute gastritis. He's in serious pain, he can't keep any food down, and he's at a very high risk of dehydration. He needs structured, thoughtful nursing interventions to actually get him back on his feet.
And this brilliantly illustrates exactly how a care plan is built for someone like Mr. X. For his acute pain, which is coming right from that mucosal irritation, the goal is to get him relief within 24 to 48 hours. Nurses are going to administer his PPIs, make sure he gets plenty of rest, and encourage him to eat small, frequent meals so his stomach isn't working overtime. For his imbalanced nutrition, they'll get him on a soft, bland diet, keeping him far, far away from spicy or fried foods that'll trigger a flare-up. Because he's been vomiting, there is a very real risk for fluid deficit, so nurses are going to strictly monitor his intake and output and hook him up to IV fluids to keep dehydration at bay. And finally, deficient knowledge is tackled right before he goes home. They'll teach Mr. X all about his diet tweaks and his new medication regimen so he can prevent this whole ordeal from ever happening again.
Section 6. Prevention and complications, securing the future.
Look, if gastritis is just ignored, the complications are severe. The inflammation can erode so deeply that it forms peptic ulcers, which can burst and lead to massive life-threatening gastrointestinal bleeding. There's also this fascinating but highly dangerous complication known as pernicious anemia. See, when the stomach's parietal cells get chronically damaged, they actually stop making this thing called intrinsic factor. Your body desperately needs intrinsic factor to absorb vitamin B12. Without it, no healthy red blood cells, and you wind up with severe anemia. And in those really long-standing chronic cases, especially the ones driven by H. pylori, there is even a risk of developing gastric cancer.
So the crucial point here is that prevention is largely in our own hands. Protecting your stomach means making some deliberate lifestyle choices. Avoid popping NSAIDs like candy. Keep an eye on your alcohol intake. Eat a healthy diet that isn't constantly irritating your gut. Seriously, find active ways to manage your daily stress levels. And if you start having persistent GI symptoms, get tested. Treat H. pylori infections early, before they have the chance to cause permanent structural damage to your stomach lining.
Which leaves us with a final thought to really reflect on today. Your stomach is working around the clock, managing literal vats of corrosive acid just to keep you fueled and alive. It is an incredible biological fortress, but it's not invincible. Think about your own daily habits, the medications you reach for, the foods you crave, the stress you carry on your shoulders. Are you protecting your mucosal barrier or are you breaking it down? Thank you so much for joining me for this explainer. Keep learning and as always, take care of your health.